Drainage external ear, abscess, or hematoma, simple. Complicated. Occasionally, a small drain tube is inserted and packing is placed to facilitate healing. A bolster with through-and-through sutures is placed to prevent accumulation of fluid. In a complicated procedure, the physician also devotes more time to cleaning the abscess cavity, and a soft sponge is placed in the canal after antibiotic ear drops have been applied. Drainage of abscess, cyst, hematoma, vestibule of mouth, simple. Complicated. The physician drains an abscess, a cyst, or a hematoma within the vestibule of the mouth. The vestibule consists of the mucosal and submucosal tissue of the lips and cheeks within the oral cavity, not including the dentoalveolar structures. The physician makes an incision in the tissue overlying the abscess, cyst, or hematoma. Tissues are dissected and the fluid is drained. Complicated drainage for larger lesions or drainage requiring multiple incisions. The physician may place a drain to facilitate healing. If a drain is placed, it is later removed. Drainage of abscess, submaxillary or sublingual, intraoral. The physician drains an abscess of the submaxillary, submandibular, or sublingual gland. An incision is made intraorally through the tissue overlying the gland. The physician dissects through the tissue overlying the abscess. The abscess is opened with a surgical instrument and the fluid is drained. Drainage of abscess, submaxillary, external. The physician drains an abscess of the submaxillary, submandibular, salivary gland. An incision is made extraorally through the skin overlying the gland. The physician dissects through the tissue overlying the abscess. The abscess is opened with a surgical instrument and the fluid is drained. A drain may be placed. Drainage of abscess, parotid, simple. Parotid, complicated. The physician drains an abscess of the parotid gland. An incision is made intraorally through the tissue overlying the gland. The physician dissects through the tissue overlying the abscess. The abscess is opened with a surgical instrument and the fluid is drained. Drainage external auditory canal, abscess. The physician makes an incision in the skin and drains an abscess in the external auditory canal. Occasionally, packing is inserted to absorb the drainage and facilitate healing. Usually no further treatment is needed and no closure is required. Drainage of abscess, cyst, hematoma from dentoalveolar structures. The physician drains an abscess, cyst, or hematoma from dentoalveolar structures. The physician may make gingival incisions to provide drainage. An artificial drain may be placed and removed at a later time. On occasion, drainage may be obtained by probing the gingival sulcus. Drainage of lymph node abscess or lymphadenitis, simple. Extensive. The physician performs this procedure to drain inflamed lymph nodes. The physician makes an incision over the affected lymph node and the abscess or infection is drained. The wound is irrigated and closed with sutures or stri strips. Drainage of abscess of pallet, uvula. The physician drains an abscess of the pallet or uvula. The abscess is opened with a surgical instrument and the fluid is drained. The wound is allowed to heal without closure. Drainage abscess or hematoma, nasal, internal approach. Nasal septum. A hemostat bluntly penetrates the pockets and allows the fluid to evacuate. Once decompressed, a small latex drain may be placed into the incision site. This allows an escape for any fluids that may continue to enter the pocket. If a drain is used, it is removed within 48 hours. The nasal cavity may be packed with gauze or telfa to provide pressure against the mucosa and assist decompression after drainage. The incision may be closed primarily or may be left to granulate without closure.